Welcome to Soni Irabor Live. Tonight, we'll be discussing issues of health. We started last week with Para Family Foundation, and this week we're going to look at health policy, health insurance, public health, and indeed the whole, well, somebody will say gamut, the whole idea of losing our very able doctors to developed countries. And they call it in the name of Jackpa and so on and so forth. And then, is government really giving enough attention to public health or healthcare delivery in Nigeria? All that we're going to be having as we have two medical doctors in the Soni Irabor Live Zoom. First is Professor Dr. Mrs. Alero Roberts of the College of Medicine, University of Lagos. And the next one is a neurosurgeon, Dr. Douglas Emeka Okor, who's a neurosurgeon and a health advocate. So please welcome them for me. Of course, the only way you can welcome them is when you watch what they say or hear what they will say. Ladies and gentlemen, you're welcome to the show. Thank you very much for coming. So, Dr. Alero, what does public health really entail? Public health. What does it entail? You're a professor.
I think that's the best part of it. The public health really entails the health of the public and everything to do with what will maintain the best of health for everybody in the public space: mental health, physical health, financial health, psychological health, neurological health, to my colleague, and not just the absence of disease. So, for people to enjoy the very best quality of life.
Do you agree with that, Doctor?
If you'll allow me an extra 30 seconds.
Yes, go ahead.
It's not just doctors.
Okay.
Public health is everybody, including you, Mr. Soni Irabor, the journalist, making this kind of a program and increasing public awareness.
Thank you. Well, when we say public health, my connection with you and your background will say, okay, what is government doing to, pay attention to public health? You see? But maybe you hold on to that, because I'm going to get to Dr. Emeka Okor. You're a neurosurgeon, and you work in Abuja.
Yes.
Federal what?
Yes.
Federal
Medical Center, Abuja.
Federal Medical Center, Abuja. So you deal with neurological issues.
Yes.
Okay. Can you enlighten us a bit more about that?
Okay, so basically, so a neurosurgeon is a brain and spine surgeon. So we are part of the team and lead the teams that actually look after patients who have medical conditions that affect their brain, their spinal cord, the spine, the nerves that supply the rest of their body. And a major part of what we do is actually doing surgery. So we actually do brain and spine surgery. So the key thing we do is actually in terms of the diagnosis, the prevention, the treatments, especially through surgery, and also rehabilitation as well. So that's what neurosurgery is all about. But when you talk about neurological care, there are other specialists that also get involved in general neurological care. People, specialists like the neurologists, specialists like the psychiatrists who deal with patients who have mental health issues. And there are other healthcare professionals that actually come into the mix in terms of providing that holistic care for patients who have neurological or brain medical conditions.
That means a whole lot. That's a whole lot there. That means you're doing a lot of work that has to do with mental stability, emotions, the brain, and all of that. I would say so. Okay.
Yes.
I've been reading a lot of your...
Well, so when it comes to emotional stability and the mental health, the psychiatrists deal with that more.
Okay. Very good. All right, Dr. Alero Roberts. Professor Roberts, I better get that right. Your job entails training of doctors.
Don't get used to it, Sonny, please. I like Dr. Roberts.
No, but truth is truth. Your job entails
I've been
training.
here for 40 years, so it's going to get a little tough.
Exactly. 40, yeah, okay, wait, let me not get confused there. Okay, now, it entails training of doctors.
Yeah.
It also entails, ensuring that patients in any hospital get maximum attention from medical doctors through consultation and prescription and all of that. All right. Do you now see you are having enough, attention paid to that kind of business from government? Did you hear me?
You know you are putting me in trouble. I have to say the truth.
Okay.
It's very difficult to actually make a blanket statement and say, yes, the government is doing enough, or no, the government is not doing enough, because it's a two-way thing. And I mean, my colleague and I were both in federal medical centers, so to speak. He's in Abuja, I'm in Lagos. And we know what we're seeing. I dare say, Dr. Okor, that on a good day, in your outpatient clinic, you are seeing upwards of 30, 40 patients, of which easily 20 are new patients whom you have to do a full clinical workup on.
Wow.
And that means that the pressure of work on our clinicians is exceedingly heavy. Now, there are a variety of reasons for this, but the major one is that we simply don't have enough trained healthcare workers for our population. That's just the bottom line. This is not new. It's something that when I tell people that even my colleagues, my classmates, 40 years ago, 2/3 of my classmates left within the first 5 years of graduation. So JAPA is not a new thing. And, we've tried with the number of medical schools we have, nursing schools we have. In fact, the nurses, I don't even want to get on their case, because if we say among the physicians it is bad, among the nurses it is terrible, really, really, really bad. We just do not have enough trained nurses for our population. And a lot, I know Dr. Okor can give us story upon story upon story about how successful a surgery he has carried out, but the post-operative care, because there are no trained neurosurgical nurses, will be so poor. So it's difficult to make a one-line statement, a blanket statement, and say, yes, government is doing well, or no, government is not doing well. We need to unpack quite a few things to address that.
This is very interesting, Dr. Okor, because from what I'm hearing now, you are a health advocate, apart from being a consultant and a neurosurgeon. It then means that the after-health care she just talked about is a major challenge. Now, how do you cope with the JAPA syndrome? Both sides.
So I think basically, like Professor Roberts has sort of alluded to, it's a major struggle in this part of the world. So even before I even go into how we cope with the different levels of healthcare in Nigeria, if you compare Nigeria with, for example, countries like Indonesia, maybe countries like Ghana, in West Africa here, countries like Rwanda, you see that for a very long time, when it comes to the issue of prioritizing healthcare and understanding that when you look at the sustainable development goals, that healthcare is number 3, that for a country to actually develop and to be globally respected, you actually have to focus on your healthcare system. We have not focused on our healthcare system, Uncle Soni. It's been a real struggle. So the struggle is across board, Uncle Soni. So any part of healthcare you want to actually bring up, is it the part of actually looking after complex patients that have complex care needs like brain surgery? Is it the part of even what we call the basic healthcare system, what we call like the primary healthcare system? It is a struggle across board. There are things that are desirable in a healthcare system, like a country that is supposed to be the biggest black nation in the world and stuff like that. But from all the levels of the people, in terms of the citizens, the governments, all the key players within the healthcare, the media. So Uncle Soni, you're doing a very good job here of actually bringing this up. The media. That we need people to actually focus more on healthcare. So the question is, okay, how are we actually managing when we look at actually looking after patients with complex care needs. In the public sector across board, Uncle Soni, it is a struggle across board. We are struggling when it comes to the issues of accessibility of care from the point of view that you look at that we have 133 million plus now, multidimensionally poor people. Access is a big issue. Affordability is a big issue. Our social healthcare insurance system, the traction that you actually need is not there. Okay, so whatever issues you want to bring up, whatever part of our health, because remember, it's a system. Healthcare is a system. Healthcare is not about doctors. There are different components of the healthcare system. And for a very long time, we have struggled with focusing and prioritizing all these different components and elements of the healthcare system in Nigeria. And so when you look at the different, like I said, the different aspects of providing this care for Nigerians, and you actually look at the different indices, when you look at the outcomes of what our healthcare system actually provides, Uncle Soni, it's a struggle across board. Rather unfortunate. But my hope is that at some point, all the key players within the healthcare system will start pushing that we can actually turn this all around. It's not all doom and gloom. There definitely some work has gone in, but there's still a lot more to be desired, Uncle Soni. A lot more.
Well, I see a situation where, for example, you're looking at both sides of the coin, so to speak, but you're also indirectly or directly actually representing governance, government, and the various ministries. You know, College of Medicine, you're a professor, and then Federal Medical Center, you are a surgeon. Let's look at how, after all said and done, is there a way that the patient can get a leverage or hope that post-surgery, for example, or post-treatment care will be looked at very seriously, and whether if you don't get that, do you talk to government? Do you talk to the people in charge? Is that a two-way communication that can give you a chance to move forward? That's my question.
So Uncle Soni, maybe I'll take this. So Uncle Soni, you've heard that slang or that adage that when Nigeria happens to you, okay, when Nigeria happens to you. One of the key reasons why most of the upper middle class and most of our political elites, one of the reasons why they don't tap into the healthcare system in Nigeria is that it is generally very weak. We have a weak and broken healthcare system. And one of the things I try to do is that the first thing that you need to actually empower citizens, Uncle Soni, is by telling them the truth and telling them the realities of what we actually have. That's the first place. So now we can actually start knowing, Uncle Soni, where can we start putting pressure? Because all the issues and some of the key questions you're asking, Uncle Soni, about some of the specifics. Oh, a patient goes, has surgery. How come we are generally struggling in this part of the world, especially within our public healthcare space? How come we are struggling with post-op care? How come we are struggling with basic services, emergency care, for example? And so how come we are struggling with that? And I'm saying, Uncle Soni, here clearly that every struggle you see within our healthcare system are symptoms of a more fundamental problem, which is the fact that we as a people, all from the top to the bottom, we have refused, Uncle Soni, to actually prioritize healthcare and give it its pride of place within our national life. And of course, when you have a significant number of people, first of all, a significant number of people pay out of pocket. Your social health insurance scheme at this particular point in time is not really working. So clearly, you're going to actually have a significant issue, okay, with actually providing that thing that we call patient-centered care, when you actually have the average person going into any healthcare facility or swimming through the healthcare system for any kind of service that you want to have. And generally, especially like I said, within the public healthcare space, you are not going to get that optimal care generally across board. So there is work to do, Uncle Soni. I yield the floor to Professor Roberts.
Professor Roberts, are you listening? Yes. Now, there are issues he has just raised.
In fact, he has said it so brilliantly.
Yes.
He has said it so brilliantly.
Okay.
He has said it so brilliantly. And you see, that's the thing that you remember that discussion we were having the other day. If we, the people, don't prioritize our health, we don't even raise our voices to say, this is not right. This Nigeria should not be happening to me like this. Remember that story I told you the other night? Maybe we'll have time to give a précis of it. Yes. But it's something that it has to, the demand needs to be created from the grassroots. But we still have this attitude where the people themselves are saying, God forbid, is not my portion, sickness is not mine, and we have an attitude of going about our lives, head in the sand, not even planning for a problem, for a health-related, I like to call it a health-related event somewhere down the line. So, I don't know what more I want to add to how, the weakness and paucity of care that we find in our healthcare sector is not just government. Remember that analogy I gave you. If government has provided the bathroom, has provided the running water, and you don't go to the bathroom to take a bath, you are waiting for government to come and bath you. How is that going to work?
Therefore, the way you maintain...
the people have to first prioritize our health, and then we can raise our voices to say, this is not working well for me. This is not happening here. We talk about, he mentioned it, and I work at the level of the primary healthcare center.
Okay.
And the question I always ask people when I meet them, where is your primary healthcare center nearest to your house?
They used to be in those days.
Do you know the name of the medical officer of health there? That is your GP. That is your family physician. That is your first point of call. If you cut your finger, you have a headache, your child has a fever, that is where you're supposed to go first. Do you know the name of the medical or the officer in charge there, the officer in chief there? And people now start looking. If you went there and you say it is not functional, those are the voices that, how does government know? Do we expect Aso Rock to go into every nook and corner and cranny of the country to see whether the primary healthcare center is functional or not functional? Not everywhere is like Lagos.
There's something like I need to say here.
Oyo is even trying a bit as well.
Yes, there's something I need to say here, Professor Roberts.
And raise their voices to say the primary healthcare center is not staffed, is not equipped. Who's going to do it?
But there are issues at stake here. One, health insurance that he mentioned. Two, availability of electricity in the hospitals. Three, is the media doing enough to create awareness? The primary health care you mentioned, for example, looks like many patients or the public doesn't seem to know its commitment to itself. So what should we do? Look at it three ways now: electricity, insurance, and then public awareness, the media. Okay, Professor Roberts. Professor Roberts, go ahead, please.
To be honest with you, that electricity issue, can you hear me?
Yes, very clearly.
That issue of electricity is across board.
Yes.
It's across board. It's the entire nation. We're talking about electricity when we're talking of income generation activities for even mothers, caregivers, parents, families to be able to sustain themselves. Because if there was power and people could have a better quality of life, a decent quality of life, we will get rid of a significant proportion of illness and morbidity in the. So we're not even talking about just electricity to the hospitals. We're even talking about electricity to the entire supply chain for healthcare, production, drugs, vaccines, consumables, all those things rely on electricity. Yeah. Information, communication, technology, it all relies on electricity. So electricity is the key thing. Power is the key thing. So we can have a whole program just discussing power. Insurance. The attitude people have to insurance is actually something that I find very scary. Because insurance is just that, ensuring that you have put in place everything that you need to make sure that a disaster doesn't happen to you. You find that everybody is driving cars with third-party insurance. Third-party insurance is the insurance that you will pay when you hit somebody else's car. What about the insurance when you're trying to replace your own car, particularly if your car is a source of income for you? No, they won't do that. God forbid, it's not my portion. My car will not have accidents. Are you praying for accidents for me? That's the attitude that we meet. Talk less then of health insurance. So let me, I mean, if I go on, I can go on for the next
please
2
go ahead,
hours.
go ahead. We have enough time. The next one is in media. Before I get to Dr. Okor, the media. What are we not doing right?
You people have tried, but in the last, since Ebola, I can confidently say since Ebola, the media, you have teamed up with the Association of Public Health Physicians of Nigeria in so many ways to ensure that scientifically accurate information is getting out there. Can you do more? Oh yes, I'm a teacher, so I'll always say that you can do better. And but I know the number of interviews I've given, I know the number of reports I've written, I know the number of TV programs like this that I've been on, where I get a lot of feedback. People were saying, well, they didn't know this, they're hearing it for the first time, and that is fantastic. We can do more. We can do more. And I think, but you see, people don't like to hear prevention. People, media thrives on sensationalism. So I can't blame you. If the patient went to hospital and it came out and was okay and everything was fine, that's not a newsworthy story. What can we say? But you can do a whole lot more. You can ensure that you are putting out scientifically accurate. I like the way you came on and you've given my credentials. You've given Dr. Okor's credentials. Anybody can check us up. They know that we are not fake doctors. Where you check us, we're properly credentialed, and therefore the information we're giving out, we will stand by it. You can do better, though.
Yeah, I think that's the bottom line. We can do better. So, Dr. Emeka Okor, we can do better, she says. Now,
yes, we can.
You're a consultant, you're a practitioner, so you are also an advocate. Now, let's look at the three tripods that I just talked about. The health, insurance, what was the other one now? Got my head. There was also the media.
Yeah.
Then, of course,
electricity.
I cannot miss that. What's your stake on it? Talking about Abuja, I hear Abuja is a field. There's a lot of power in Abuja.
Okay, so clearly, like I said, I think usually I like to actually start with perspective first and actually lay a background and a foundation, because we need to actually understand, have perspective on the foundation of where we at. You can only move to great places when you understand where you are. So the key thing, one of the key things I always say, Uncle Soni, is that when you think right, act right, and spend right, then you're likely to actually do this properly. Now, first of all, let's start with the thinking. What is the philosophy that guides every strata of our society in Nigeria? Okay, and let's compare it to the philosophy that guides maybe people in the US, in the UK, other European countries and stuff like that, and ask, why are those countries developed? Why is it actually that their governments really focus on healthcare and we do not focus on healthcare? There's a philosophy called the value for human life. So what is the value for human life in Nigeria? All the way from the presidency, the National Assembly, to the state governors, the House of Assembly members, it is actually not there. So that actually dovetails into the way we actually do things. You talk about electricity, okay? Now, remember, I said, think right based on philosophy. That will now actually drive what kind of actions you take and what you actually spend on. One of the key things I say in terms of the development of any country, especially Nigeria present day, there are 4 key things that you must actually really spend your money on. And they are security, because of the problems that we have. Number 2, infrastructure, especially power. That's what you're actually talking about, Uncle Soni. And then health and education. Without those 4 things, especially in contemporary Nigeria, you are going nowhere. So, for example, let's talk about philosophy and the thinking. Abuja, the Federal Capital Territory. Let's combine 2 very, very important projects that they've actually spent money on, maybe in the last 2 years of this present government. Okay, 39 billion was spent on the conference center, International Conference Center. 21 billion was spent on refurbishing the Vice President's house. Now, let's think from the point of view. These are very important projects. I think they are important. But from the priority point of view, and looking at having the mindset and the philosophy of value for human life. So that's what? That's 60 billion naira. What are the 60 billion naira was put into the Federal Capital Territory's primary healthcare system and the emergency, having a coordinated emergency care system? Will that impact more in the population in that place? So that's one thing, that the thinking is generally faulty. You talked about the media. The media does a couple of things. It educates, it informs, it entertains. But a very key thing that the media does is that it sets the agenda. Okay? While I agree with Professor Roberts that yes, the media has done some work. Oh my God, Uncle Soni, there's still so much work to be done. We can not only push things that are sensational. The media needs to understand that when you say sustainable development goals, there's a reason why development and goals is there. And if out of 17 of them, the people who actually coined this together put healthcare as number 3, imagine that, Uncle Soni. That means healthcare is extremely important. Now, the question will be, and remember, I'm not just saying government, because Professor Roberts has actually rightly said it, that what is desirable is when you actually have personal responsibility, community responsibility, state responsibility, government at all levels responsibility and stuff. But we know that when it comes to those responsibilities, there's a massive gap. And so, clearly, part of what people like me do in time, part of what people like Professor Roberts and what you're doing as the media, Uncle Soni, is to actually keep pushing that narrative and keep stamping it and saying, hey, this must reverberate across both horizontally and vertically, that our healthcare system just has to work. We can't develop as a country about healthcare system. And our healthcare system, I repeat this, it is a broken healthcare system that needs lots of work. Lots of funding, financing, lots of work to do with the healthcare services, lots of work when it comes to consumables, medicines, vaccines, lots of work when it comes to using the digital technology as platforms to actually push this, lots of work when it comes to government policy, implementation, interventions, and things that need to be done. So much work on Soni, and I think that across board, looking at all the key players, starting from government, the healthcare professional bodies, or other faith-based organizations, community-based organizations, NGOs and stuff, we are not doing enough to keep pushing this thing that is so important, that is number 3 out of number 17. So much work to be done, Uncle Soni, because like I always say, the Nigerian patients are worth it.
Okay, now we're going to take a short break, and when we get back, we'll look at health is wealth. And then we'll also look at placing our priorities right. How come the human Nigerian, I say human Nigerian, does not have respect for the dead or for even life, as it were? We'll be right back. Welcome back. Well, health is wealth. That's how I ended the last break, right? The last half. And how come human Nigerians don't give respect for life? And then, of course, what do we place as our priorities? Now, I have Professor Alero Roberts of the College of Medicine, University of Lagos. And then I also have Dr. Emeka Okor. You know, Dr. Emeka Okor is Douglas Emeka Okor. He is based at Federal Medical Center, Abuja. Now, thank you, both of you, because you are actually giving you are trying your best to manage the frustrations that I seem to be getting out of you. But the frustration is almost, frustration is almost total. So let me just say this loud and clear. There's so much expected of you, but there's also so much expected of Nigerians, the public. So, Professor Roberts, starting with you, you are a teacher of men and women. That means you train them to do a few things to the best of their ability, your ability and their ability. And so you will have to now assess them and expect that soon after they should be able to give up their best. All right, now, so were you trained as well. Health is wealth. What does it mean in earnest? Health is wealth.
I see that's a fascinating question to answer, and it's one that we have very many seminars in the classrooms about, because in this 21st century, anybody who goes into any health science is not doing it from a point of view of getting stupendously wealthy. No, they're coming into it from a very altruistic point of view. And therefore, they totally understand. In fact, they understand more than anybody that health is wealth. The problem is that they fail to see that the majority of the populace that they are now going to have to deal with don't see it the same way. Tend to take it all for granted until there's no health. And then they suddenly realize that way back when is when they should have been putting things in place to ensure that their health is optimal and can be maintained or can be restored within their resources. So it's something that we discuss a lot, because when I tell students, student doctors, student nurses, student physiotherapists, when I tell them that, look, the populace you are dealing with don't think like you. It's what Dr. Okor said. Let us first put the contextual perception to it. They don't think like you. So you first have to come off your high horse and come down to their level to understand where they perceive health and what they're doing. I've had this discussion when this was a very sad one, but to give a context to what I'm saying, this young man, he must have been in his mid to late 30s, is calling in the middle of the night. He's very angry. He's brought his father in. By the way, Dr. Okor, you will understand this. His father is terminal prostate cancer, mid to late 60s. Terminal prostate cancer, which he has had for several years by the admission of the son. The son is dragged from where he is in another state and he's come to Lagos. He's brought his father to the hospital and he's angry that the doctor said that the father needs surgery, but nobody is rushing to do the surgery. Of course, his blood picture is out of whack. I don't want to get too technical. His blood picture is out of whack. And so the team on call says, well, we need to put the father on dialysis, get the blood picture back to normal, and then prepare him for surgery. When you say it like that, it seems very straightforward. But we understand that we're just saying this thing. The amount of work and money, out of pocket payment that is going to be expended on getting the father onto the dialysis, testing and retesting, because we're going to ask the family to bring money for blood tests, and they'll say, if we're doing blood tests, where's the money to buy the drugs? Just give us the drugs, let the man get better. We're talking terminal cancer. A fair number of people have no idea what we mean when we say terminal cancer. So I'm the person, of course, I was the go-to person then. So I sat the young man down and I said, come, do you have an hour? Let me give you medicine 101 to 505 in 1 hour and teach you everything you need to know. He admitted that he had been told a lot of this thing, but he did not understand. So he didn't ask questions. So the implications of what he was being told didn't register with him. And at a point, I was very rude, and I asked him, I said, come, did you do SS2, SS3? Because I am certain it is in our integrated science curriculum. You don't have to get to university to know this. Anyway, the bottom line was that the father was going to need 3 or 4 dialysis sessions to bring that blood picture back to normal, or to a state where the surgeon will even attempt to do a surgery, not for cure, but for comfort. So the young man finally gets the picture and he says, so, Ma, are you telling me that my father is going to die? I said, soon and very soon. Then he kept quiet. Then he said, so what do you think I should do? I said, well, if I'm to be brutally honest, I will pack all this money you are about to spend and put it into a trust fund to educate your younger ones, because no amount of money you throw at this situation now is going to change the outcome. I said, but I'm not allowed to be brutally honest. So I will tell you, do the best you can. And please go to what I call the FFF, Family and Friends Fund, to see if you can raise any more money. He said, Ma, I thank you for being brutally honest. The father died 3 days later.
Oh, wow.
Fully with dignity, because the young man decided he would take his father home to his own house. To terminal prostate cancer, what are we talking about here?
Matter of time.
Dr. Okor, maybe you can put it into better English. But this is what we are talking about. The family had no perception whatsoever of what was going on. What needed to have happened way back when was that all of them needed to be on health insurance. That way they would have been getting regular screening. That way we would have picked up these prostates when it was a 10 naira problem. Not now, at the end of the road.
Wow. Okay.
I yield.
Hey, Dr. Okor, you know, this,
Yes.
in fact, this is a brutally honest interview for both of you, and I'm really happy that I was able to get the two of you together, to express your views and issues like this. Look at it from these perspectives, Dr. Okor. One, the patients, the public. Two, the people in government, because they have a responsibility, whether we like it or not. So what then should we do if situations like, and in fact, the three would be media again, because this public awareness, I have to say it, we really must be there. Yes,
Very
please
important.
go ahead.
So let me start with the first question you asked. Our health is wealth. What does it actually? These sustainable development goals. So any country that wants to have a resilient, robust, sustainable economy must pursue the sustainable development goals. So that means to have a robust economy where you don't have the major issues of accessibility, affordability, and availability of care. Where you actually have a significant number of poor people, where once somebody just runs into trouble with healthcare, the person becomes broke and becomes very, very poor, sells everything and stuff like that. It gives you an idea how very important healthcare is to the economy of a country. That's why you see that other countries that we always look up to, because that they actually prioritize healthcare. If you look at United Kingdom, for example, every campaigning time that comes and stuff, the National Health Service, the NHS, is the first top on the line in terms of what they're discussing. The people, our politicians now, they're already jostling for 2027. So we talk about media, for example. Who is asking them now, what is your strategy for healthcare? Because in a country like Nigeria, while, again, I'll repeat this, while we need personal responsibility, community responsibility at different levels, it is still governments, federal governments, state governments, that must grandstand this agenda and push healthcare. See, Uncle Soni, if we leave it and say, hey, individuals, use your church mind or use your mosque mind, be good now, have some sense and stuff like that. It doesn't work that way. Even from the point of view of looking at things like even this massive advocacy, massive education for the public, putting resources in terms of interventions in the right places and stuff like that, it is still governments that are going to do it. I think from our own point of view as citizens, and again, bringing out the media and stuff like that, we need to be actually putting our leg on the chest of governments, and making them understand. No, because first of all, we have limited resources. So how are we spending those resources? I just gave you an example in a budget, for example. The way our politicians spend our resources, from a philosophical point of view, it leaves a lot to be desired as by the question of governance and understanding and providing healthcare, especially for those vulnerable 133 million now plus multidimensionally poor Nigerians, where even what you're looking at is even basic access. Basics. You're looking at the basics: hygiene, sanitation, basic healthcare, which is basically not available at all. So the question about, who do we now hold responsible and stuff? We hold all ourselves responsible, but especially the governments. I will keep calling them out, because they drive. In terms of when you're looking at development and how we can actually evolve as a people, the people, our politicians, the people, and I usually call them now these office holders. Our office holders now need to be leaders, transformational leaders that understand that, first of all, if we talk about building an economy that is sustainable, that is resilient, you cannot forget healthcare. And what I'm saying, Uncle Soni, is that so far, even since this democracy started, healthcare has been relegated to the background. And we want a situation where all key players, the media especially, start putting it in the front burner. Remember, 4 key things that we must invest in: security, infrastructure, especially power, health, and education.
Before we go to governance, let's stay with the public a little bit. What is expected of the public to, for example, personally, I should expect that anybody that has a toilet should keep the toilet clean, manageable, and be able to use it, Abi. And so, therefore, the role of the public should be how much can they do to help themselves? Say heaven helps those who help themselves. We heard of health is wealth. Heaven helps those who help themselves. What's the next one? Well, if you are a leader, then you must be a leader to govern well. You must be like a servant. That means you are serving to lead. So my question now to both of you would be, is there any hope that there can be a kind of relationship between government and the people? In which case there's no denial, there's no run away from your responsibility. Because as we expect so much from government, so do we expect so much from the people. What do you have to say, Professor Roberts?
So I'm very skeptical about this, and I think one of the things that I know I've heard said and I have quoted several times. The scary part of democracy is having a 5-minute conversation with the average voter, because people who would relinquish their power for half a nylon bag of rice and 2 yards of cloth, and they relinquish the power of and render themselves powerless, it's actually quite scary. Because if we don't create the demand from the grassroots, if we don't hold people accountable, the so-called, what did you call them, Dr. Okor? Position holders.
Okay.
If we don't hold them accountable, they will continue to do as they please. 60 billion naira spent on renovating infrastructure. Somebody comes and they say they're putting primary healthcare centers, left, right, and center. And the question we ask them, sincerely, but our voices are too few and far between. When you have built this thing and cut the ribbon and opened it, who is going to manage? Who is going to staff it? How have you ring-fenced the financing, the supply chain? How have you made it accessible to the average person? And, these are the things that we've spent 30, almost 40 years on this. At the end of the day, come 2027, Connie, they'll come again and distribute half bags of rice and 3 yards of cloth, and everybody will be saying, Ranka Dede, yes, continue. It's your turn. Please keep going. And we have the same rubbish happening all over again. I'm skeptical, but I've met quite a few young people who are giving me hope. There's a young man I was listening to the other day. He was speaking on another station, and he was talking about educating the average voter and making them aware of the power of their hands and of the power of their vote. And I was really quite encouraged listening to him. I will get his name, Soni, and pass it on to you, because I think he's somebody that you too need to speak with.
Probably Peter Aka. Is it Peter Aka? Probably Peter Aka is his name.
Okay. Right. Okay.
I think that's him. I think that's him, yes. I think that's him. You are right.
Now, the question would be, what do you expect the public to do in the wake of so many situations that are misprioritized? And then prioritization not from governance alone, but even from the people themselves. Remember, I had said in my when we were going on break that the average Nigerian doesn't seem to have value for life. And then you, as consultants, as the medical personnel, you're seeing this, you are dealing with them one-on-one. And from your story there, Professor Roberts, there was that really got to me about the young man who brought his father to the hospital at the late hour. Now, how can we correct these anomalies? Because it's a terrible thing. That's one. Number two is the jackpot syndrome. We have less than 5 minutes to go. Jackpot syndrome. People are going. Nigerians are going. Youths are going. Doctors are going. Doctors are even going to some of the most difficult places on earth. You see a Nigerian there, a Nigerian doctor for that matter. But they say they are not. So what should we do, Dr. Okor?
So Uncle Soni, what is desirable? Okay, but like I said, I talked about the issue of personal responsibility, community responsibility. So from a personal responsibility point of view, you talk about things like healthy lifestyle choices, isn't it? Okay, make sure you exercise, eat good food, drink lots of water and stuff like that. Health, your hygiene and sanitation, like we already talked about. Taking personal responsibility while taking community responsibility. Better health-seeking behavior. Okay, better health-seeking behavior. Then number 4, which is even the most critical, being citizens. Okay, informed citizens that have that thing that I call what do we call it? That actually has that very, very strong baseline of thoughts. Okay, that can actually think about things properly. Okay, that's what is desirable. Okay, so that's from the personal responsibility or community point of view. From government point of view, like I keep saying, we are going to 2027. Can we please start asking the right questions? Hey, people that are jostling for power, from the length and breadth of all people who want to be office holders, and we are hoping that they will be transformational leaders. Okay, can we ask them about what they're going to do about security at all levels? Can we ask them, what is your thinking of relevant infrastructure? I see most of the time, for example, in Federal Capital Territory, building flyovers everywhere. Who told you that we need flyovers compared to actually our good primary schools that work, and actually primary health centers that work, and a coordinated emergency care system that actually works? So we need to start asking these guys across board, what are your plans for this? Is for health, for education? And one of the things I'm even worried about is not even the big stuff. I'm worried about even the basic stuff. Basic education, basic healthcare, health and hygiene. Okay, now when we talk about the issue of jackpot and stuff like that, when you actually have healthcare workers, healthcare professionals working in a toxic system, in an environment that doesn't support what they do, their remuneration is very, very poor and stuff like that, they will vote with their feet. When they actually have other places that actually take them serious, respect them, okay, provide what they need for them and their families and stuff, they will vote with their feet and go. So when it comes to actually keeping healthcare workers on the ground on Nigeria, it is still back to the issue of, hey, across board at the different levels and cadre of human beings within our space, Nigeria, our governments, for example, National Assembly, where are you putting healthcare workers in the scheme of things? How important do you think they are? There was a 300% increase in the salary of judicial officers. Judicial officers are very, very important. But are we saying they are more important than healthcare providers? Again, back to the philosophy of the value for human life and how you're prioritizing things. So clearly, from a personal responsibility point of view, from a community point of view, there are things that we hope that we push, that we can actually do for ourselves. Citizen power, okay? I want to see enough citizens talking about healthcare.
Okay.
I want citizens to be coming out on social media to say, hey,
Dr.
you governments and office holders, what do you think about healthcare?
Now, let me have your final thoughts, both of you, Professor and Doctor. Your final thoughts on what we've discussed so far. What's your advice to government and what's your advice to the public? Professor Roberts, we have 1 minute to go, 30 seconds each.
I think I'm going to go with what Dr. Okor said, and I think we should talk with a unified voice. People need to be asking the questions, what are your thoughts, what are your plans for education, for health, for infrastructure, for security? If we are not asking those questions, if we're not holding them accountable, we're just wasting our time.
Dr. Douglas Emeka Okor.
Yeah, so healthcare in the development and evolution of any country is foundational and extremely important, and Nigeria cannot be an exception. When we are comparing our country to places like Indonesia, Ghana, Rwanda, we are doing so badly within our broken healthcare system. So we need governments, we need all the key players, the healthcare professionals, the citizens of Nigeria to keep pushing and keep asking the key questions. Governments national, state. What are you going to do about healthcare? We need to do this and continue to do this, Uncle Soni, because the Nigerian patients are worth it.
Thank you so much, Professor Alero Roberts and Dr. Douglas Emeka Okor. Thank you so very, very much. This has been a very heated argument, and I could feel your emotions, and I think I was emotive myself. So thank you for giving us this opportunity. I will call on you again, I beg you. And so, Soni Irabor Live today has looked at health, and we're leaving it over to you to debate further. Good night now.